Hello, everyone. My name is Marty Guthmiller. I am CEO at Orange City Area Health System, bringing you today on December 7, 2020, the 77th edition of our COVID-19 community briefings. As today is a Monday, I'm going to start off with our local scoreboard, and I'll just jump right in. At Orange City Area Health System, we've had 1,573 positives of the 7,605 tests that we've conducted. That's a rate of 20.7%. Not much different than it was before, 20.6%, and the time before that, 20.0%. For the week, we had 64 additional positives of the 290 tests conducted last week. That is a rate of 22.1%. That is down significantly from the previous week at 38.9 and the week before that at 23.2. Sioux County, we've had 12,250 individuals tested with 3,909 positives. That is a rate of 31.9%. Times before that, 31.7 and 31.2. So some modest growth, but not exploding at this point. We have had 64 new positive individuals since Friday. So that's a pretty big number as well. In terms of Sioux County and the 14-day averages that we've been tracking, generally speaking, Sioux County is down a little bit. We are number 25 now in the state of the 99 counties. Sioux County is 20.0%, 14-day positive average. That is down from 20.8, 23.3, and 26.3 previously. Number 4 in the state is Plymouth County at 25.6%, really static in Plymouth County. Our previous 3 times were at 25.0, 24.2, 25.2. So hovering right around that 25% mark for the last 4 times now is Plymouth County. Lyon County is declining a little bit. They are now number 7 in the state at 23.9%. That is down from 26.0, 31.3, and 34.2. So they're coming back into more of what the norm appears to be in Northwest Iowa. O'Brien County is number 33 in the state at 19.1%. Again, they've been really static in that 19% range, with last time being 19.5, time before that 19.4, and the time before that 18.9. So O'Brien County 19.1. Number 1 and number 2 in the state are Kossuth County at 30.1% and Cherokee County at 29.2%. Just as on Friday, 96 of the 99 counties in the state of Iowa are at 11.4% or greater. Region 3, not a great deal of change since Friday in Region 3, although it is down. We currently have 174 hospitalized individuals in the 20-county region in Northwest Iowa. That number is down from 179 on Friday, but 205 the time before that. So that's a nice decline there. However, we do have 37 folks in the ICU in Region 3. That is up from 31 on Friday, but down from the time before at 41. So Region 3, 37 ICU patients, 17 of those 37 are on ventilators. So they are sick, definitely. A bit of good news is that there were 17 patients admitted in the 20-county region in the last 24 hours. That number has been higher than that recently. For example, on Friday, that number was 29. So 17 is a pretty decent number in the last 24 hours. Moving to the state of Iowa, we have had 1,251,391 individuals tested. So about a third of the state. We've had 244,844 individuals test positive. That's a rate of 19.5%. 1 out of 5 individuals tested, in other words, were positive, have been positive. Not much change in the past. That number was 19.4 on Friday, 18.9 the time before that. A couple other numbers that I mentioned on Friday that the state has the coronavirus.iowa.gov website has added some stuff, and I'm trying to be consistent in what I've reported in the past, but maybe add some good stuff down the road too. These are a couple of those things. And I'm going to be giving the 14-day average for Iowa and the 7-day average for Iowa on an ongoing basis now. I think those are good numbers. Again, a little bit more of a glimpse of what's going on in the last week, in the last 2 weeks. I think that will be as important as historical numbers where we've been since the beginning. The 14-day average in Iowa is 16.4. That number on Friday was 16.6, so that's moving in the right direction. And the 16.4 statewide compares to Sioux County at 20.0%. The 7-day average, which is a newer stat that the state's been providing, is 13.4%. So in the last week, we've had a 13.4% average positivity rate. Again, that doesn't tell you a lot until you compare it to the time before that, and that was 14.4. So we had a 1% drop in our 7-day positivity. So that again is a good sign. Another good sign is the number of hospitalizations in the state. That has dropped to 918. That includes 55 Iowa residents hospitalized outside of the state of Iowa. The 918 is a drop from 1,162. So quite a drop, and that's good. The time before that was 1,175, and the time before that 1,333. So 918, relatively speaking, from where we've been, is a good number. In terms of locally, Sioux County 14, that stayed the same since Friday. O'Brien County 2, that was 3. Plymouth County 13, they're down from 20. Lyon County 0, down from 2. Woodbury County 47, a nice drop down from 57. Polk County, a really nice drop. They're down to 88 hospitalizations. That's down from 111. So across the state, got about a 250 decline since just Friday. So that's a very positive. I should mention though that while some of these stats are static or maybe even improving a little bit, we're not done with this. And an example of that is that we've lost 114 Iowans due to COVID death since Friday. That number is now 2,717. Another example of we're not out of the woods yet by any means. The number of ICU patients and the number of ventilator patients in Region 3 is another indication that we're not through with this. And so Sioux County officially has 29 deaths, but there really is no change in the demographics at all. It's still 53% above the age of 80, and still I think 92% 60 and above. I'm going to switch now from our stats into just some local things that are going on and give you a little bit of a glimpse what's happening in our health system. Our senior care, again, is a big area of concern since, again, most of the deaths are in that age category. Prairie Ridge this past week had 0 positives again. I'm very blessed, very grateful for that. Thank you to our staff for the discipline. Thank you for families and understanding what's going on and the importance of that. 0 positives was another great week for us. Again, a reminder, we do test staff twice weekly, and we test residents once weekly at Prairie Ridge. At Landsmere Ridge Retirement Community, we have no new news to report there, so things are going well also at Landsmere Ridge. A reminder that our Test Iowa site is still up and running and available in MB1 on the west end of our campus. There are signs on the doors, so if you go into the west end of our campus, see big MB1 on the building, and there'll be signs into what door to go into there. Again, 8 to 9 in the morning, Monday through Friday of each week. The tests are coming back a little bit quicker right now, which is, again, a sign maybe that the labs across the state are not being overwhelmed right now, but certainly closer to 48 hours in terms of that test coming back, but usually not longer than 72. Just as an example of the volume, on Friday, it was down a little bit. We did 18 PCR Test Iowa tests last Friday. In terms of things going on at the hospital, it's been relatively calm, and certainly, compared to what we've been like over the last several weeks. We do have currently, as of this morning, 13 inpatients, 3 of which are COVID, and so a very manageable situation. Our ER over the weekend was quote unquote fairly normal in terms of the types of things that we would have historically seen in the ER. It was much more like that over the weekend, and not extremely busy either, which is good. Vaccine status. There's going to be a lot of news this week on the vaccine. My understanding is that the FDA is meeting on Thursday, the 10th. We expect the Pfizer vaccine to be released, but that's about as much information as we have at this point, because we're ready to play the game. We just need somebody to tell us what the rules are. Everything is staged. We're ready to go. We have forms signed. We're in the queue. We're ready to go. But we don't know yet how much we're going to get, how many doses. First of all, we don't know if we're going to get them. We don't know when we're going to get them. We don't know how many we're going to get. But we do have a rough idea of the prioritization of that, but that'll also be communicated by the state and through community health partners. But certainly nursing home residents are going to be at or near the top, as are frontline healthcare workers. And so stay tuned. We'll probably do a separate briefing just on the vaccine as the information becomes known to us. We just can't give it now because we don't know what it is. It's a very, very fluid situation. But when it happens, we'll be very transparent with you. It may require some quick action on some decision points, because maybe we'll have some doses available. We are not expecting general availability to the public, though, at this point, but we are beginning to prioritize by maybe a certain demographic or a certain age group or some things like that. So again, stay tuned. That's largely it for the day. There are some signs of things getting better. There are certainly fewer signs today of things getting worse. So even if we can't say they're getting better, Today, we can't really say they're getting worse, and you can find ways to be pleased with the trends of the numbers, the way they're going. Again, I say that we can't let our guard down. We have to stay strong. We have to stay very vigilant in all the things we've talked about all along. Please continue to do that. Mask up, keep social distance, keep your hands clean, your hygiene good, and we'll get through this. We're almost there. And so I don't want to say that the finish line is too close either, because it'll likely be several months yet, but we're starting, and we can see the light at the end of the tunnel. And so thank you for joining us. Thanks again for the trust and confidence placed in us. And remember to stay strong, stay vigilant, and stay healthy. Thank you.